How's it? This is Joao Lagrivi, founder CEO of Powbox. We're here at HIMSS 18 in Las Vegas. I'm here with Laura Merrick, and she's with Medical Home Network. I just met her a few minutes ago, so let's get started with another version of HIPAA Center. Laura, thanks for joining us.
Thank you for having me.
Can you tell us more about the scope of your work at Medical Home Network?
Certainly. So Medical Home Network is a formal provider collaborative that was founded and funded in Chicago, Illinois. Our focus was improving healthcare delivery and innovation, focusing on reinforcing the centrality of the medical home. So we began our work about 9 years ago, bringing providers together to share around a common vision to support the Medicaid patients that were so disparately separated across the south side of Chicago. We had several opportunities along the way, and one of those was that we formed a Medicaid ACO known as the MHN ACO. So the Medical Home Network ACO, known as MHN ACO, supports 9 federally qualified health centers and 3 hospital systems through our innovation in technology and healthcare delivery. We are connected with 25 hospitals around the Cook County area and 180 unique medical homes to support the care for the Medicaid recipients on the south side of Chicago.
Medical home, is that a skilled nursing home? What exactly is it?
No, don't let our name fool you. At the time when we first started the work, we were really focused on reinforcing primary care, and a term for a medical home is a term where a patient can receive everything that they need around primary care. That might be access to behavioral health or community resources, and it's a place where they can not only seek the care that they need, but the help to get the care they need by their care manager. And so the network that we created in the beginning of our work was really about bringing providers together, both in that medical home setting, to drive and sort of support the primary care model. And so we were able to do that with not only the primary care community, but also hospitals, and really drive communication, and that was really key to really engaging and reaching patients.
Healthcare is notorious for lack of, definitely.
Right.
So MHN's been around for 9 years, if I heard you correctly. How long have you been with the company?
Since it was founded, I believe is 2008, I was one of the second employees.
Oh, wow. Mm-hmm. So almost from the beginning.
Yes.
Wow. So HIMSS 18, well, what's your biggest takeaway for this year?
You know, I think for the work that we do, it's validation that we're on the right track, driving innovation across our area. That there are opportunities to share best practices with others that are doing the work that we're doing across the nation, and that there is more that we can do around improving access to data and ultimately the care for our patients.
Laura, is HIMSS part of your annual conference schedule, or is this your first time here?
It is my first time here.
Oh, wow. Well, you picked the right location, because last year was Orlando. This is more preferable for me. Closer and a bit more fun.
Yeah.
Great. And last question, where do you see the future of your industry going?
I think it's innovation. It's healthcare innovation, and that is wrapped around not only technology, but how we implement the technology and the meaning behind how we connect data to get access to care for these patients. So I really think it's continued innovation to empower care management activities, to empower reaching beyond the healthcare ecosystem into the community, and to really think a little bit bigger about how we really provide care.
Man, Laura, thanks for spending time with us. Really appreciate it. Nice to meet you. Aloha.